I heard the pop, and I had heard the pop is like the kiss of death.
It's going to be some of the most painful rehab an athlete can go through.
I felt a pop feeling in my knee. It popped back into position, and then I felt myself get slingshotted to the ground.
I heard a pop and pretty much knew that was it.
If you don't stay motivated, you can damage your chances of getting better again.
That was my first thought, that I'm not going to be able to play next year.
Left wing, fakes it through, around the McDonald screen, pops it 10, good.
Felt like my leg fell off, like honestly, like it hurt really bad, and it's like a sharp shooting pain.
The road to recovery of an ACL tear is a long and difficult one. The ACL is a ligament that connects the bones in the knee. Tears of the anterior cruciate ligament, better known as the ACL, are incapacitating injuries that can occur during everyday activities. Whether it is a mild rupture or a severe tear, everyone is at risk, even you.
The ACL is one of the more important ligaments that we have in our knee. There's basically 4 ligaments that we have. 2 of them that are in the middle and 2 of them that are on the sides. And the ACL is one of the ones that's in the middle. And your body really uses that and relies on that as the pivot point for you to rotate about when you're doing activity. So without the ACL, the knee is very unstable.
The ACL is this ligament here, and it runs from the tibia, the lower bone, up to the femur, where it connects on the outside portion of the condyle, or the lateral femoral condyle. And this is about the size of what the ACL would look like in a native knee.
The ACL is one of the more common injuries that you hear about in athletics. It doesn't happen as much as some other injuries like ankle sprains or things like that, but the problem is when you do tear your ACL, you tend to miss a year of activity.
The most common causes of ACL tears are these non-contact types of injuries during athletic participation. A non-contact injury is when the athlete is in isolation without any other opponents or teammates around, not making contact like you would consider in football with somebody making a tackle. That would be a contact type injury.
Most people would think if you're going to tear your ACL, it's going to be somebody running into you. But by far the most common way that we see an ACL tear in an athletic population is somebody running down the field, they stop, they pivot, and when they twist, their foot is planted, their knee buckles, and that's when the ACL gives out. And usually it's either a twisting type position or a hyperextension, so where the knee actually goes back beyond straight, and that's where the ACL tears.
The biggest difference between a contact injury and involving the ACL and a non-contact injury with the ACL is oftentimes you may see more damage in the contact injury because of the increase in force that the athlete is sustaining.
And oftentimes an athlete will come in and they'll say, I was running down the field and I bumped into another athlete, and that's when I thought I hurt myself. And if we go back and look at the video, there's no contact. It's just they pivoted and twisted, and that's when the injury occurred.
A particular type of movement that we would see in a non-contact injury, for example, in basketball, when the athlete jumps up for a rebound and comes down to the ground, they land awkwardly. Or they land and they try to rotate and change direction suddenly, and that's where they will sustain a ligamentous tear of the ACL.
So what happens is the body is moving so quickly, and then it stops and switches direction so fast, the ligament can't withstand that stress, and it just pops. Occasionally you'll see it in motor vehicle accidents or just horseplay sometimes, but by far the most common is in sport type injuries.
A Florida college athlete previously tore the ACL in her left knee and received treatment at the Morsani Center by Dr. Larry Collins.
When I tore the first one, it was actually a week after I was done playing soccer, and I was playing another intramural sport, football, flag football, and I was the running back, and I went to do a cut, and it twisted as well, and I fell.
She has returned for yet another ACL rupture in her right knee.
So I was playing basketball, and I tore it on the court. I was trying to go up for a ball, trying to catch it in the air, and I just came down on it. Somebody hit me in the air, and I came down and twisted my right knee.
When a patient comes into the office and you twisted your knee, whether it hurt or not, you say you heard a pop, and later that afternoon or that evening you had swelling in your knee, I would tell you about 80% of the time you have an ACL tear, and that's without me examining you or doing any more questions.
The different types of symptoms that I've seen with ACL tears are large effusions or joint swelling in the knee suddenly after the injury. The patient will, or the athlete will complain of instability. They feel like their knee is giving way, or they try to change directions while they're walking, and part of their knee turns one direction and the lower half of the leg tries to go in a different direction.
Oftentimes the ACL, when it tears, it sounds like a small gun goes off. You hear a loud pop.
The popping sound is actually the ACL or the ligament itself tearing and rupturing. It creates a loud pop because it's a very stout ligament, and it takes a lot of force to tear that ligament. So once it reaches its point where it will tear through the injury, that's where the loud pop is what you hear.
I think I did hear a pop. I did slam really hard on the ground, so it was hard to hear if it popped or not. And I could immediately feel it was weak. I laid there for a second, and I previously have torn my left one, so I knew it was kind of the same thing that time. Like, I heard the pop, and I had heard the pop is like the kiss of death, so I was definitely very worried about that. And it did swell a lot more than my right one did. I actually ended up not just tearing my ACL, I tore my medial and lateral meniscus, as well as straining my MCL. So there was a lot more going on with my first tear.
The individual for a few seconds is in excruciating pain, and then after that time period elapses, they oftentimes think nothing is wrong. With a good amount of ACL injuries, within 24 hours the knee will swell profusely.
After an athlete tears their ACL, medical examiners have ways to test the severity of their injury.
The ACL is responsible for preventing the tibia from translating anteriorly on the femur, and one of the hallmark tests is going to be called Lockman's test, and that's going to be where I'm going to pick up the femur and the tibia and translate them on one another, and I'm going to compare bilaterally. If there's an ACL tear, the tibia will come out a lot further on the femur, whereas compared to the other side there won't be as much laxity.
We've all seen the season-ending ACL injuries in professional sports, but more often than not, this injury affects the average person. Taylor Narazonik is a 19-year-old college freshman who tore her ACL playing ultimate frisbee.
I was playing defense. We were in the end zone. My girl was really fast. So I was sprinting to catch up to her, and then she made a hard cut, and I planted my cleat in a soft spot and twisted and went to sprint the other direction, and I just fell backwards and tore my ACL. And right there I knew I was going to have surgery.
Women are 4 to 6 times more likely to tear their ACLs than their male counterparts.
There are a lot of different theories as to why this occurs.
There have been some studies that show that in the female population, one of the reasons that they maybe get ACL tears more than men is some of their muscular function is not exactly the same as in men or as in boys.
It's more common in women because of the way that they're built. They have a different angle to their pelvis and to their knees, and so more women tend to be knock-kneed, or valgus as we would say, and that puts a lot more pressure on the ligament.
Women are notorious for horrible landing technique. If you ever watch a girl jump down from do box jumps or something like that, watch their knees, or even a squat, they'll tend to come in with their knees.
So there's many theories on exactly why, and I think it's probably some combination of those. I personally feel it's probably more some of the biomechanical, some of the physical aspects of it, the anatomical considerations have something to do with it, and possibly even the hormonal.
I see so many girls that have torn their ACL or at least have a knee brace. And if I talk to them, most of them say it was ACL.
Women tend to have inadequate ratio between quad strength and hamstring strength. The quads tend to be a lot stronger than their hamstrings, which will cause it to tear.
Young women, young girls, when they grow up, they don't train the same way that young boys do. They don't play the same way, so they don't learn how to run and jump and stop and start the same way. And so when they grow up and all of a sudden now they're playing higher level soccer or basketball and they run full speed ahead, their body still isn't trained how to run and stop and start. And so they're at more risk for, if they're running full speed and they stop, they just don't do it correctly, and boom, their knee goes out, and that's how they tear their ligament.
Rehabbing from a torn ACL is a long and unpleasant process.
The one thing that bummed me out was I knew I couldn't play for 6 to 8 months. Well, it's been about 3 months now, and in those 3 months I've gotten full range of motion. I just started running this week. I still can't swim yet, but I'll get there. I mean, going into it, I was kind of afraid. I've heard it's like the most painful thing. Now the most painful part is over, so now it's kind of just exciting seeing how much progress I've made. I will absolutely make a full recovery. I think I'll even be better than I was.
Although female athletes are more prone to ACL tears, nowadays the older population is seeing an increased risk in ACL injuries. A study presented by the American Academy of Orthopedic Surgeons found that senior citizens who undergo ACL surgery are just as likely as younger people to return to pre-injury levels of activity.
You know, in 50 and 60-year-olds who, again, 10, 20 years ago you would say, you're 60-year-olds, you tore your ACL, just live with it.
The biggest risk factor for an orthopedic injury is recent history of having that injury before. So obviously the older you are, the more opportunity you're going to have a history of that problem. So yeah, you are at more risk when you're older, but not just because of your age, more because of the experience of your body over that time.
You know, now we have 6-year-olds who are still very, very active. I mean, our population is aging, and as a result of that, and as our aging population is healthier, and so wanting to stay more active, they're doing activities that they didn't used to do and putting themselves at risk, and so they can have an ACL tear.
Doctors in Philadelphia documented a 400% increase in ACL injuries among teens and adolescents over the last 10 years. A torn ACL can threaten to end a teenage athlete's career before it even begins.
Usually it's, you know, you're getting into your teens, sometimes a little bit below teens, but that's pretty unusual. So teenage and above is typically where you see it.
James Helm is one of those teenage athletes, and here is his story.
I tore my ACL my sophomore year playing football. I remember I ran a route, caught the pass, running upfield, and then the safety came down and just hit me right on my knee, and I just fell straight to the ground, and that's all I remember from there. I was 16 when I tore my ACL. I witnessed another ACL tear too. One of my good friends tore it right over here. He was running down as a gunner, and then he was just trying to make a move around the guy, and then he made a move and he was running, and then he went to replant his foot to go towards the punt returner, and he just blew his knee out and just fell. On top of playing football, I also played lacrosse. Right after I tore it, I didn't go straight to the hospital because they said it was a partial tear. So I waited that whole summer. I rehabbed the whole entire summer because they said you can come back if you just rehab it. So I rehabbed it, and I put the brace on, and they were like, if your knee gives out while you're in the bracing, you have to get surgery. So we were doing drills right here, and my knee gave out. Felt like my leg fell off. Like honestly, like it hurt really bad, and it's like a sharp shooting pain. They thought at first that my tibia and my fibula broke. 6 to 8 month rehab. I started running probably like three months after the surgery. Actually, I came back better. I came back faster and bigger and stronger.
As it is clear, ACL tears are not just reserved for male athletes. From an increase in young athletes tearing their ACLs to new findings that show women are more prone to ACL injuries in numerous ways. ACL tears occur when you least expect it.
I just bent my knee in, I heard a pop, and pretty much knew that was it.
After you've been diagnosed with an ACL tear, the next important step is prehabilitation.
You need to get the motion back before we do the surgery. And one of the ways you can do that is physical therapy.
Once you know someone has torn their ACL, you do strengthening of the quads, hamstrings, different stuff before they go in for surgery. That way they're at a higher strength level before, and then they won't atrophy quite as much when they come out.
So if you don't have your motion back before surgery, there's a certain risk that the knee might get stiff after surgery. And we call that arthrofibrosis, which just means that there's scar tissue inside your knee.
Realistically, it's probably minimum 3 to 4 weeks after the injury. But that's about the normal time frame. About 3 to 4 weeks when we call the initial period, the acute injury phase is over, and the body tends to start to reach a steady state again. Then that's when we can go in.
So a lot of it is the mental capacity and being able to encourage them, keep them going.
So I wasn't really scared. It was more of a challenge I can accept. It's something that'll help me.
Surgery is necessary to prevent further damage to the knee over time.
And that used to be done as an open procedure, so they would literally cut your knee open. And the problem with that is by violating the joint, by cutting through the muscle, the tendons to get to the joint, that hurts the knee a lot more in terms of the recovery after the surgery. So nowadays that can be done arthroscopically through tiny little poke holes in the skin.
And we drill a hole through the tibia and a hole through the femur, and we pull the tendon in through those holes, and then we fix it on both ends. We take a special device that allows us to take from the inside of your knee one of your hamstring tendons, and then once we have that, we prepare it so that it's ready to be used as a tendon. So once we've got these drill holes and we've got the tendon inside the knee, once we've pulled it in, we would fix it on both ends, either with screws or with metallic fasteners. We tension it so that we know that the tension is correct, and we make sure that your knee is no longer unstable.
This metal screw is a screw that we used to use, and some people still use these, and these work very well. These screws basically go into that tunnel alongside of the ligament, and they basically hold the ligament in place. Nowadays we use ligament or screws more like this one, and these are made out of biocomposite materials that basically dissolve over a period of time. And nowadays these screws actually are impregnated with calcium pyrophosphate or other materials that actually help them turn into bone, so that this won't set off a alarm, say in the airport like this one would, and also on an x-ray or something you would never see this. And also if that patient re-injured their ACL, say 10 or 15 years later because they got back into playing basketball, if this screw's there, we have to go in and take this one out before we put the new ligament back in, as opposed to this one just dissolves away, turns into bone, so it's basically gone after a couple of years.
Even though a partial ACL tear may allow you to function normally, it's up to the individual whether they want to undergo reconstruction.
I had a partial tear in my ACL and my lateral meniscus, I believe, and then but I never got it repaired when I played. I just played through it, and I had a brace or whatever, and then I re-injured it and re-tore it playing basketball.
We have ACLs for a reason, and the knee is set up such, if you're going to be active, you need to have it. So if you tear your ACL, or frankly if you even have a partial tear to your ACL, you need to get it fixed, because the whole biomechanics of the system changes dramatically, and then you're just setting yourself up for other problems.
So yes, if you don't have your ACL done, you can get back and play sports, but that recurrent instability in your knee is more likely to lead to arthritis. And so in most of the American surgeons' minds, the real reason to do your ACL surgery is not just to feel normal while you're playing sports, but to protect you as you get older so that you don't have arthritis.
People come back from them all the time. It's just another thing that you have to, get through. There are a lot of people doing college athletics and professional athletics that have had multiple ACL tears and are doing just fine. It's gotten to be a very routine thing. It's not as a big deal as it used to be.
The challenging thing from a patient standpoint is not the surgery, because the surgery, you come in, you go home the same day. The challenge is the rehab, because you have to do rehabilitation to get your muscles to come back to full strength. And that really does take about 4 to 6 months.
People that suffer an ACL tear, the first decision is whether they're going to have surgery or not. Once we make that decision, then they either go through the surgical process followed by rehabilitation. If they're not going to have surgery, then they'll typically have rehabilitation immediately until they've returned to whatever level of function they need to.
The biggest thing that we worry about, one of the things that the ACL does is it prevents your shin or your tibia, the bone on the bottom, from moving forward. right? So when it prevents it from moving forward, that the ACL that's its job. Well, one of the muscles that does the same thing are your hamstrings, right? Your hamstrings, or the muscles in the back of your thigh, are responsible for that same maneuver. They keep the tibia from moving forward. So one of the main things that we do during rehab is try to strengthen those hamstring muscles as much as we possibly can to assist the new ACL that you have in there from keeping the tibia from moving forward. So any kind of leg curls or hamstring strengthening things that you would see people do in the gym are what we're going to be doing in rehab.
The first thing you're going to want to do is focus on full range of motion, largely at terminal extension. If it's a partial tear, we'll have a knee immobilizer for the first couple of weeks. That's just going to allow the stresses to be taken off of that ACL, give the fibers time to heal, that scar tissue to form, sort of stuff, and then you can start doing more functional exercises.
Physical therapy after ACL reconstruction starts very early and actually varies depending on the patient as far as the type of surgery, the type of graft that was used, as well as the progress that the patient makes early on. So many of our patients that regain their range of motion, their ability to walk very early, actually will reduce the use of therapy until a later time when they've healed, and it's time to work more on strength and stability and return to sport or whatever it is that they need to return to.
Damali Mills, a high school athlete, tore her ACL at school during a volleyball game when she made contact with another player. The American Academy of Orthopedic Surgeons estimates that 30% of ACL injuries occur from contact with other players.
My ACL tear occurred at a school game. I'm a blocker, so during a game I went up with my teammate and she jumped before me, and of course since she jumped before me, she landed before me. And I landed on her foot. And in reaction to jumping down after the block, she pulls back to go to her position. And after her foot pulled away, my knee went in. I felt a pop feeling in my knee. It popped back into position, and then I felt myself get slingshotted to the ground.
It's going to be some of the most painful rehab an athlete can go through. 6 to 8 months of intense rehab.
I was afraid to hurt myself again after the surgery. I didn't want to damage myself more. I really like volleyball and I want to keep playing it, so I was afraid to hurt myself again.
We also have those patients that, for whatever reason, whether there are other injuries or they're fearful, that require a lot more therapy early on to make sure that we regain their motion and they don't have any long-lasting impairments.
There's a variety of different exercises you can do in physical therapy to rebuild the muscles following an ACL injury.
Focus on increasing quad and hamstring strength, so anything from like squats, leg press, biking is a good one to start out with, calf raises, even balancing techniques, a lot of hamstring curls, quad extensions. Once you develop the range of motion and the strength, you get the proprioceptive stuff, having them balance, jumping, lunges, plyometrics, agilities. You get them all the way back up to where they're doing cutting drills.
The recovery was definitely a more psychological battle because naturally, I'm naturally athletic, so my body sort of grabbed at the chance to get back in shape. But because of my fear of getting hurt again, it did get in the way a little bit.
It's a very long, strenuous, painful rehab, and for the athlete or the patient, they're going to get depressed a lot. They're going to get discouraged when they don't make, the range of motion that's set forth for that day. And a lot of it is just working with them, keeping them excited about rehab, coming back and forth, setting little goals and that kind of stuff so that they can look forward to the next day and see their progress. Whereas a lot of times it can be scary coming out of a knee brace for 2 or 3 weeks, and then your whole quad is atrophied and you have no calf muscle, whereas they're used to having these large muscles and be strong individual athletes.
As far as ACL prevention goes, there are many suggested ways. However, not a lot yet that we've proven. We do know that changing the biomechanics or the way somebody moves can reduce the risk of injury. There are many other factors that we're still studying in females, such as hormonal changes, to the type of equipment, even to the type of field that our athletes are playing on.
According to Emory University's School of Medicine, 3D MRI technology has allowed surgeons to see from one point to the other on either side of the knee to correctly position and place the new ligament.
The advances in technology for us are probably in our ability to analyze motion in 3 dimensions. And we've learned a lot more about the actual mechanics and movement that occurs at the knee and what we need to do to prevent the movements that place the ACL at risk. Even in the short 8 years that I've been practicing, it has changed. The surgical techniques are better, the grafts that they use are better, and the fixation of those grafts are stronger, and so this allows us to be more aggressive early on with the rehabilitation. We also have a lot more research on the best types of therapies to use and outcomes for our patients. And so yes, it has changed a lot, and it continues to change because it's such a common injury that we are continually researching.
There's no doubt that ACL tears are on the rise among athletes. Those who have experienced this life-altering injury know that staying engaged is key during the rehab process.
Staying positive is definitely a good thing. You have to look at the bright side because it'll motivate you, and motivation is definitely a good thing. If you don't stay motivated, you can damage your chances of getting better again.